This 13-year-old male patient fell off his bike about 2 months ago and traumatized teeth number 7, 8, and 9. All three teeth were partially avulsed according to the mother. He was taken to his dentist and teeth were repositioned and, as you can see, splinted. And then he was referred to us for consultation and endodontic treatment. So by the time I saw the patient, a month had gone by, and a month had gone by post trauma. So when I examined these teeth, of course, they all responded necrotic. Remember, they were partially avulsed, and you can see there's a periapical lucency here, and one starting to form right there. Of course, these are necrotic teeth, and makes sense that a month post trauma, you be seeing things like that happening to the teeth and to the periapical area. Again, remember, these were partially avulsed, so that's number 7, number 8, and let me show you number 9. And that is tooth number 9. So 7, 8, and 9, and you can see the periapical lucency here. And smaller ones starting to form right here, okay? So, of course, we went ahead and explained everything to patient's mother. So explain everything to patient's mother as far as what's going on. So these teeth, of course, they're all necrotic. And because of trauma, a few things can happen, and you definitely need to discuss all of that with the patient, if the patient is 18 and older, or patient's parents or guardians or what have you. So one is, of course, discoloration of the teeth. You need to discuss that with the parent or the patient. Discoloration can happen, of course. The other thing that can happen is ankylosis. These teeth can become ankylosed. And the third thing that can happen is inflammatory resorption, root resorption of these teeth. So these are all the things that there's possible for them happening, and these possibilities definitely need to be discussed with the patient or patient's parents. So we can go ahead and, of course, do what we need to do, but a patient's dentist will need to keep an eye on these teeth and make sure that those things aren't happening, and if they're happening, then they need to be addressed properly if need be, and if possible. So we discussed everything with the patient's mother, and of course she wanted to try to save these teeth, and that's what we did today. So we went ahead and sedated him today, and did number 7, 8, and 9 root canals, apexifications. As you can see, these are open apices in one appointment, and take a look. Sometimes with these teeth, because the apical diameter is large, you don't get a good reading from your apex locator, electronic apex locator, so it's always a good idea to go ahead and take a working length PA. In this case, I did get a good reading, but I still wanted to confirm my working lengths, and that's what we did. So number 7 was 20 millimeters, number 8 was 22 millimeters, and number 9 turned out to be 23 millimeters. And again, you can see the open apices here. Okay, so we knew ahead of time that we needed to do apexification, and we of course use white MTA. And here is the post-op. As you can see, everything went beautifully. So again, the apical diameters were large. So this, I believe the apical diameter of tooth number 7 was 60, and these were, I believe, 60 and 65. So placed an MTA plug, that's an MTA plug. We used white MTA here, white MTA here. Looks like I got a little bifurcation or a lateral here on tooth number 8 with the MTA. So MTA plugs followed by gutta percha and sealer. Again, we did these root canals in one appointment. So you can see everything went great. Everything went beautifully. We went ahead and temporized the teeth and referred the patient back to his dentist. Mom will take him to his dentist for the permanent restoration of these teeth. Of course, here you can see the periapical relucency associated with tooth number 7, periapical relucency associated with tooth number 8, and another one, small one, that's starting to form associated with tooth number 9. So white MTA plugs. Look at that beautiful lateral there. And this is gutta perchance sealer, gutta perchance sealer, gutta perchance sealer. Again, we did all of this in one appointment. And yes.